Chemotherapy for tuberculous meningitis. Medical English presented by Aida Morileño. Teacher Joe Moscoso. Definition. Tuberculous meningitis is the most destructive form of the disease, with tuberculosis bacteria infecting the thin sheaths covering the central nervous system, resulting in fever and headache. One-third of infected patients died despite current treatment. There is a video. Application in medicine. The first consists of streptomycin, isoniazid, and rifampicin daily for the first 2 months, followed by ethambutol plus isoniazid for 10 months. In the second, pyrazinamide was added for the first 2 months, and in the third, rifampicin was reduced to twice weekly in the first 2 months. Steroids were prescribed for all the patients in the initial week of the treatment. Approximately 50% of the patients were aged less than 3 years. On admission, 13% of the patients were classified as stage 1, 77% as stage 2, and 9% as stage 3. Cerebrospinal fluid culture results were available for the 180 patients, and tuberculosis was isolated in 59. There is a video. Pros and cons. Cons. First, the most common toxic effects were due to streptomycin, which caused valvular damage in the last number of patients. Prolongation of chemotherapy increased the risk of toxicity. There is a scarcity of controlled trials of antituberculous drugs in the central nervous system. Also, the hepatotoxicity is a negative aspect. Proof. A major advantage of giving chemotherapy directly is that the drug usually don't reach other parts of the body. It's a video. All patients admitted between 2000 and 2004 at Eugene Special Hospital and major public care centers located in Quito. In worm and tuberculosis treatment was started, but chemotherapy is an expected treatment. Conclusion. TB meningitis occurs when Mycobacterium tuberculosis invade the membrane and fluid surround the brain and spinal cord. Normal antibiotics don't kill Mycobacterium. You need to take a combination of special antibiotics for several months.